The goal of universal health coverage is to ensure that all people obtain the health services they need without suffering financial hardship. Every year, an estimated 1 billion people do not receive the basic healthcare that they need. To tackle this global issue, countries have sought to develop a robust health coverage system to improve the health and welfare of its citizens. Singapore is a global city with good facilities, among them a first-world healthcare system achieved in a little less than 50 years. Behind our quality care is a story of foresight and fortitude that helped build Singapore's healthcare system to what it is today.
In the 60s, healthcare was not as it is today. It was quite, in a way, you can use the word primitive, but we did the best we could at that time. Hospitals were very old. We had no money to renovate. Wards were very congested. And we had to work under very great stress.
At that time, you are always shortage of nurses, and when we go to the wards to work, it's more of hands-on and manual. The equipments we use not so high-tech. We recycle things. I remember where the syringes, it's in glass syringes. After use, we have to wash and then keep them and send them back for autoclaving and reuse them back. We even have to sharpen needles.
10 years ago, Singapore faced our first major health crisis as an independent nation, when SARS, or Severe Acute Respiratory Syndrome, broke out in March 2003. Singaporeans rallied together and we emerged stronger from the experience. This would not have been possible without the contributions and sacrifices of our healthcare workers. Today, through strong political leadership and a long-term commitment to universal health coverage, Singapore has developed a robust and comprehensive healthcare system. This coordinated approach has been successful, with Bloomberg ranking Singapore's healthcare system the first most efficient in the world in 2014. The Economist Intelligence Unit, EIU, has also ranked Singapore second best in the world for healthcare outcomes, with a generous healthcare system, high life expectancy, low rates of ill health, and low mortality. The Singapore government's key role is to assist those who are less able so that healthcare services are affordable to all. Along with its Healthcare 2020 master plan that aims to improve healthcare services for Singaporeans, it has developed strategies to build an inclusive healthcare system for the future.
One of the key challenges that Singapore is facing is, of course, the aging population. As we age, our need for healthcare will change. Firstly, the demand will grow because as we get older, we will need more healthcare services. Secondly, the type of healthcare services will also shift from the more acute cough and cold to change to more chronic diseases, diabetes, high blood pressure, and so on. So these are the challenges that we'll be facing. Therefore, we will need to look at how we can expand our capacity to meet the rising demand. At the same time, we also need to make sure that we keep our healthcare services affordable, not only for now, but for the long term as well.
This multi-tiered approach includes building facilities to meet the needs of the population through polyclinics, hospitals, as well as skilled manpower, creating affordable healthcare through medical savings schemes and government subsidies, and helping Singaporeans plan for old age whilst promoting a healthy lifestyle. Through capacity building, Singapore's medical facilities meet the demands of its 5.4 million population. Subsidised polyclinics and hospitals provide affordable healthcare, and skilled manpower ensures quality care. Currently, Singapore's public hospitals comprise general hospitals, a women's and children's hospital, and a psychiatry hospital. In Singapore, primary healthcare is provided through an island network of outpatient polyclinics and private medical practitioners' clinics. As well as building facilities, Singapore's healthcare policies emphasise health promotion, personal responsibility, and encouraging the elderly to remain healthy and active for as long as possible. Lastly, Singapore's healthcare system also offers affordable and accessible healthcare through heavy subsidies. This can amount to up to 80% of the total bill in acute public hospital wards. Several schemes are also in place to cover a range of medical expenses. The new MediShield Life will be implemented by the end of 2015, which will offer better protection for all Singaporeans for life. Singapore's forward-thinking approach to healthcare has also garnered awards for some of its groundbreaking initiatives. One such initiative was Alexandra Health's Aging in Place program. It was the first public healthcare system to win a United Nations Public Service Award. By identifying patients with 3 or more hospital admissions, hospital staff visit their homes to customize care plans and manage their conditions with appropriate interventions. Since it began 3 years ago, the readmission rate has seen improvement of 67%. Of the 400 patients under the AIP program, 47% of them did not come back to the hospital after intervention. Singapore's healthcare system is designed to ensure that everyone has access to different levels of healthcare in a timely, cost-effective and seamless manner. Moving forward, Singapore is working towards reducing the reliance on acute care in hospitals and expanding more facilities and services into the community. This will allow Singaporeans to stay healthy and recover from their illnesses within the community as much as possible.
Given the changes in the global landscape over time, our healthcare system will also need to change, need to evolve over time to make sure that we are able to meet the healthcare challenges globally as well as for our Singaporeans.